When an implant fails, a lot of times the patient doesn't know that the implant is failing. If they're not coming in for recalls, I mean, you could be losing bone around an implant and you don't actually really know until actually it's possibly too late. Then usually you're going to call because something doesn't feel right. And most of the time it's going to be either because something's loose or the gum is hurting around it. If an implant is failing, a lot of times the best thing is we get it, we take it out and we start over. We want to get to that point, we want to get that implant out before it causes a lot of bone destruction, because it can. Just like a bad tooth can cause a lot of bone destruction. Same principle. So the earlier we catch it, the easier it is to fix. When we do a dental implant, we follow very closely on the healing process of an implant. I usually tell a patient it's 3 months for a mandibular or a lower implant, and around 4 months to 6 months for an upper implant because the bone is a little softer. Patients must be compliant, they must listen, they shouldn't eat on it. That will actually cause some problems, and food and debris can get under the flap and the tissue because it's not completely healed right after the surgery, and then that of course increases a bacterial influx, which can cause bone loss and actually early failure of the implant. If you have a failing dental implant that you believe that is failing, or you have multiple implants that you feel that you're having a problem, neglecting or waiting, thinking that things are going to get better is not a good thing. Please just contact our office. Let's get you in, let's get an x-ray, let's get an examination, let's see how we can protect your investment.